Okay, well, thank you so much, everyone. I'm so honored, particularly to have this introduction by my dear friend, Plain White, who's a giant in our field. And when Terry sent me the original email about this, honestly, it brought tears to my eyes. I feel very humbled by your recognition. I mean, taking care of patients with MPS disorders has been the joy of my life. And I'm so grateful to you for the award. I have the opportunity to speak for a few minutes, and so it gave me a good opportunity to reflect back on my time as a geneticist, all of that time, during all of that time, having seen patients with MPS disorders. And in the beginning, I titled it Reflections on 47 Years with MPS Disorders, because that's how long I've been working as an attending physician. But really, my exposure to patients with MPS disorders started over 50 years ago. So it really coincides with the anniversary of the MPS Society. Here are my disclosures. And the way it all began is that I was in medical school at Northwestern, and during my senior year, I did an elective rotation in genetics. The chairman of the Department of Pediatrics at that time was a geneticist, so I went and worked with him on an elective, and during that time, I met two sisters with MPS 1, Hurler syndrome, Janice and Melissa Peterson, and I use their names with permission that I'll mention to you in a minute. And they had really a profound impact on me. They were lovely, lovely little girls. But of course, there was no treatment available for them at the time. There was no transplant. There was no enzyme replacement therapy. In fact, we really didn't have the kind of diagnostic testing we have now. This was the fall of 1972. That was the year that the enzyme defect in MPS 1, iduronidase deficiency, was described by Liz Neufeld's group. We weren't doing that yet. So the way we made the diagnosis in patients was urine spot tests for mucopolysaccharides, followed by getting a skin biopsy and looking at sulfate uptake in the cultured fibroblasts. And then if you couldn't tell if it was MPS 1 or 2, you mixed the cells together. You did the classic mixing experiments. And if they didn't correct MPS 1 cells, it was MPS 1, and so on. So it was a very different era, both for diagnosis and, of course, for treatment. Prenatal diagnosis was not possible back then. There was no carrier testing. So these girls really cemented my interest in genetics as a career, and particularly in the field of metabolic disease. And then as a fellow, I came back to the same group several years later. I'd finished my pediatric training, came back and did a fellowship in genetics. And I met them again many times, Janice and Melissa, because we were at that time trying to do primitive enzyme replacement therapy. The concept was there. We knew it was an enzyme deficiency. So we were doing regular plasma infusions as a way to try to give them enzyme to treat their disease. I see Joe Munzer sitting in the audience, and he and I talked about this period of time because he was up at NIH with Liz Neufeld implanting amnion into the peritoneal cavity of patients with MPS disorders. That's another potential way to get cells in there that could provide enzymes. So we thought about enzyme replacement therapy, but we certainly didn't have it. And of course, it wasn't successful in Janice and Melissa, and they both succumbed to their disease before they were 10 years of age. But they are implanted in my mind. I see them vividly. Unfortunately, I lost my photos of them with a computer accident. But after I finished my training, I went off to North Carolina for 11 years, and I came back to Chicago in 1989. And sometime after that, probably in the early 90s, I was watching the Oprah Winfrey Show, which was filmed in Chicago. She did her show in Chicago. And you might wonder, how is it I was watching it? in the middle of the day and I worked full time, but I think it must have been on the waiting room TV or something in the hospital. So Oprah was doing a show on the impact of sibling death on children. And a call came in from a woman by the name of Carol. And I knew these two girls had only one sibling, a sister, who was Carol Peterson. And she talked about the fact that she had two sisters who had Hurler syndrome, this rare genetic disease, and had died, and the impact that it had on her and on her family. And I said, I know who that is. And so I called the show and talked to the producers and said, I'd really like to talk to that lady if I could. And they said, well, we'll call her and see if she's okay with it. And if so, they would connect us up. So I got a chance to talk to her, and I told her what an impact her sisters had had on my life. And she was really happy to hear it. And she said she's so happy to talk with someone who remembered them, who knew them. And I said, I will mention their name every time I get the opportunity, because they affected my life, certainly in a way that was very important. So that was my first exposure. And then over time, of course, we continued to see patients with MPS disorders. Thankfully, HSCT became available for MPS 1 in the mid-1980s, but initially that was only for patients who had a matched sibling donor, so not everyone could take advantage of it. Later on, of course, when we started using cord blood, it became possible for almost every patient to find a donor. But throughout the 80s and 90s, there was no treatment for any of the other MPS disorders, although diagnostic testing was significantly improved and prenatal diagnosis became a possibility. But I think it was very common during that time for geneticists to make a diagnosis of an MPS disorder, counsel the family about it, and basically they returned to care with their pediatrician and went on. And, that was kind of the end of the story. And then we got into the era of ERT, of course, which was very exciting for all of us. The recombinant DNA technology came about, made it possible to make these enzymes in the laboratory. And you all know what happened since, beginning with MPS 1 in 2003 and MPS 7 in 2017. But of course, there is still no ERT or other approved therapy for MPS 3A, B, C, or D, MPS 4B, or the mucolipidoses. What else has changed, though? I think we've gotten much better over the years with supportive care. As I mentioned before, patients used to just go back to their pediatrician. We weren't proactive in looking for complications of the disorder, which we could have treated and can make life better for patients with MPS disorders. We had management guidelines published that emphasize the importance of proactive surveillance for treatable complications. And of course, we had the National MPS Society. And I think they have just a lovely timeline in your program showing what has transpired with the National MPS Society over these 50 years. And along with it, also the developments in the field are really nicely laid out in there. So that's a really great summary of what's happened in the last 50 years. And as you'll see there, this started in 1974, a year after I graduated from medical school, as parents of MPS, then became the MPS Society. And I think when I started practice, there were about 100 members in the National MPS Society. 1979, they said 150, and look at you now, and look at the incredible research funding provided by the MPS Society, the incredible patient support, meetings like this that are so incredibly important. And during that time frame, we've also seen the emergence of several other disease-specific organizations that I think also are very important, things like Project Alive or Cure Sanfilippo, that really impact the lives of families, but also are so important in educating funders and our governments with regard to the importance of paying attention to patients with rare disease like MPS disorders. So really a lot has changed, but one thing that I am so happy about is the fact that we now have newborn screening. And I see Mike Gelb sitting here. He's the one that led us down that path. And of course, you're going to hear from him later today. But we now have virtually almost universal screening for MPS 1 in the US. And although we don't have the long-term outcome data yet, you and we all know that there's no doubt that this is going to significantly impact the outcome for these MPS 1 children who can have transplantation very early in life before irreversible damage occurs. And for our attenuated patients, they have the opportunity to get treatment and avoid that diagnostic odyssey that is so characteristic of the disease. MPS 2 is now on the RUSP, and I think it's going to proliferate among states much more rapidly than MPS 1. It took us almost 10 years to get from going on the RUSP to almost universal screening for MPS 1. I don't think it'll be as long for MPS 2. I've seen, since we've had it in Illinois since 2017, I have seen the incredible outcomes that we're seeing in our babies who are diagnosed and treated early with MPS 2. So this has been huge, I think, but we need it for all the MPS disorders, right? We have one state doing MPS 4A. There are pilots for several other MPS disorders. We have treatment for MPS 6 and 4A. Those disorders should be part of newborn screening, and we need it for MPS 3, where we are soon going to have, I think, approved therapies. It's absolutely critical. So we have a lot more work to do in that regard, but yet it's so encouraging. We've also seen expanded carrier screening for couples of reproductive age. I have seen couples who have been identified as being at risk for MPS 1 never having had an affected child or having anyone in their family, because there are now laboratories that offer screening for up to 500 different recessively inherited conditions, and you get carrier couples who would not have known they were carriers until the birth of that first affected child, which is, of course, what happened to almost all of you, I'm sure. Same for MPS 2. So this is making a difference, and then they can be counseled of their risks and offered reproductive options to modify that risk and have choices with regard to their reproductive planning. So what about newer therapies? Well, you're going to hear about these in detail tomorrow from Dr. Munzer, but of course we have countless newer therapies now in clinical development, either preclinical or in clinical trials. You're going to hear from the various companies who are involved in the field also. And what's so exciting is now we have the potential to possibly treat the brain in patients with MPS disorders, kind of our last frontier. And likely within the next several years, certainly hopefully, there will be several of these therapies approved by the FDA. You'll hear from REGENXBIO about their intracisternal gene therapy, and then we have the fusion proteins designed to cross the blood-brain barrier from Denali and JCR Pharma, and Ultragenyx with the gene therapy for MPS 3. In addition, we have patients among us who have been benefited so much by the intrathecal therapy for MPS 2, which will not be approved by the FDA, has not been, but have done extremely well, far exceeding our expectations for them, and just showing us where some of our problem areas have been in the past. And with the FDA, hopefully things are changing. And you're going to hear more from Matthew, I think, and others about that later on. So what else is coming? Lots of other things, you know, earlier in development than the ones I just mentioned, and Joe will talk about these, so I won't go into them, but other forms of gene therapy, in utero therapy for severe MPS disorders where a baby's known to be at risk, tested and found to be affected, and many other promising therapies being investigated in preclinical studies. So what does the future hold? You see, you know that we have come an incredibly long way in those last 47 to 50 years that I've been out there in the field. But we all know that we still have a long way to go. But there's so much hope for the future. And I am very confident that one day we will see a time when our MPS patients can live a long life free of pain and disability, and that they can do all the things that I've had the privilege of being able to do, to pursue a gratifying career, to move into retirement, spend time with my family, see my grandchildren grow up. That's what we want for all of our patients. I'm confident that some of you in this room will live to see it. I won't live to see it, but some of you will. I think you will. We'll identify them at birth. They'll be treated, they'll be cured, and life will be very different. I also feel like we'll reach a time when doctors don't know what MPS disorders look like because of what I just said. We'll find them early, they'll be treated. It won't be the same. It'll be like polio. You know, I've never seen a patient with polio, thankfully. And they will not see a patient who shows what we think of as a natural history of MPS disorders. I'm sure it's going to happen. And before I end, I just want to say a few words about the many, many patients that I've cared for MPS disorders over the years. Their care has been the joy of my life. All of the patients pictured here are no longer with us. There are many others. This is just a few, but I remember every single one, and I always will. And I have learned so many lessons from them about the diseases, of course. These are rare diseases, so every patient teaches us new lessons about the disease. But more importantly, I've learned just countless lessons about living a good life. I've seen patients face adversity and pain with incredible courage. I've seen parents meet challenges that I think most people would view as insurmountable, and they've done it on behalf of their kids. I often wonder if I'd be able to do the same thing under similar circumstances. I think you're a remarkable group of people, and you know, you deserve all of the respect and admiration that you receive. Certainly, I am in awe of what I see from MPS parents. I've also seen patients just live joyfully in the face of all of their challenges in a world that's not always kind to people who function differently or who don't look the same as other people. But yet they find tremendous joy in life. So many important lessons. I'm grateful, very grateful for it. And to my current patients, and some of you are here, I love you to pieces, and I will always be watching to see how you're doing. I want to thank you for entrusting me with your care. It's been a joy. I will miss seeing you regularly, but I'm leaving you, I know, in very good hands, and you will never, you may be surprised to see me pop up here and there from time to time. So I'm not disappearing. And these are just a few of my current patients pictured here. And you see Hendrix, who was up on the stage. You see him off on the far left, George Washington, and down in the bottom. But I love them all. It's been tremendous honor and privilege to take care of each and every one. And I want to thank the MPS Society as well for all that you do, both for those of us who treat patients with MPS disorders and for families, and for the incredible honor bestowed on me today. The leadership of the MPS Society is just beyond measure fantastic. I've known Terry Klein for many, many years. since long before she came to the MPS Society and was involved with ISMRD. I mean, you couldn't have a better CEO than that. She is amazing. Leslie Ernetta, I mean, you know, what she does for families is unbelievable. I mean, it's really, you know, beyond amazing. And then Matthew Ellenwood, of course, he has, you know, raised the scientific level of the society. He's just done a magnificent job in representing the society in so many different forums and in raising the research profile of the society. So you're very lucky, I think, to have them in the leadership roles that they play in the society. And to all of you, congratulations for making this such an important organization that serves our families so well. So thank you again. You know, it's been a privilege. I couldn't be more honored, and I'll remember this forever. Thank you.